is Jackie Glass. I'm a licensed clinical social worker. I'm a licensed psychotherapist, and I've worked in the field of mental health and chemical dependency for over 20 years. So one of the questions we often get from patients and family is, what is treatment? What are the levels of care, and what does it involve? And so we're an evidence-based treatment program. And what that basically means is we have what's called a biopsychosocial model of how to help patients. So there's many different disciplines that are involved to help patients. So specifically what that means is anytime a patient typically comes into treatment, is they're going to come in on a detox level of care. And so what that means is we're going to slowly take them off of whatever drug of choice they have and give them comfort meds if necessary and make them as comfortable as possible. But it's more than just medically detoxing somebody. So when they come in, the good news for the patient is we give them a treatment team. So the team consists of a medical doctor who's going to assess them for medical issues. And in addition to a medical doctor, we work with a psychiatrist. And just for the purpose of this conversation, this pitchfork actually means psychology or psychiatrist. So a psychiatrist will assess the patient to rule out any psychiatric issues. That takes some time though, because we're not really quite sure how many of the symptoms that we're seeing are related to withdrawal or related to a psychiatric issue. Some patients come in on psychiatric meds already, but the psychiatrist will work with the medical doctor to kind of do what's called a differential diagnosis and give the right treatment. Psychiatrist also works with the medical doctor about withdrawal and withdrawal symptoms. So we want to make the patient as comfortable as possible and give them some withdrawal medications that will help them and also stop them from having possible seizures or other problematic medical conditions as a result of withdrawal. In addition, we give the patient a primary therapist. And what a primary therapist does is, I am a primary therapist, so I will meet with the patient one time per week for psychotherapy and to help the patient acclimate not only to treatment but to sobriety as well, and also assess for mental health conditions and treat that as well. So I counsel the patient one time per week. In addition, we do a family contact with their consent. And then 5 times per week, I meet with the patient in a small group for an hour and a half of psychotherapy. And that means processing their issues, but also sometimes psychoeducational, because it's not enough sometimes to talk about their feelings and establish what their issues are. We have to help them to stay in solutions as well and give them coping skills. So in a nutshell, and that is a very brief nutshell of what we do, that's what a primary therapist does. And with consent, we will contact family one time per week. And we want to get the family involved. It's very important because we want collateral information. We're not always quite sure what the patient is sharing, if it's enough information. Sometimes patients withhold information. Some patients are so sick they don't provide important information. So we really want significant family members who are helpful involved in their treatment. So that's what a primary therapist does. And in addition to a medical doctor and a psychiatrist and a primary therapist, they also have case managers. A case manager will help a patient with any work-related issues. We work with EAPs, if they need FMLA, if they need Social Security disability, if they have problems paying their rent. So what happens is we will help the patients in terms of all of those case management issues. Case management starts the minute they come into treatment because sometimes they also have legal issues, DUIs, that have to be addressed as well, or contact with their employers. But it also is important because we want to start to discuss their discharge plans. So discharge plans are going to be important because we want the patients to not only maintain their treatment gains, but build upon them when they get out of treatment. So that actually begins immediately along with the rest of the disciplines. We also have 24/7 around-the-clock nursing care. So what happens is we want to make sure that the patients are as comfortable as possible. The nurses work very closely with the doctors and the rest of the team, and they are there around the clock in different shifts to help the patients feel as comfortable as possible through the detox process. In addition, we have kitchen staff, and so they're getting their meals, healthy meals provided for them. A lot of patients who are going through detox are not hungry. We want to make sure that they're eating because that's going to be really important, not only for their health, but for craving management. And so the kitchen staff is there, and of course we work with nutritionists in addition to finding out what our patients' medical needs are. If they're diabetic, kitchen staff has to know to make sure that the patient's diabetes is being managed. In addition, some of our patients have cultural or religious restrictions, so we want to make sure that their treatment is specific to their cultural or religious needs as well. In addition, so you can see that all of a sudden our patients have this Verizon wireless commercial of people behind them, of a lot of people who are there to help them. So there's multi-disciplines. We have housekeeping to keep the place clean. We have housekeeping because sometimes they might need more sheets, they might soil the sheets, they might need more towels. So we're here to help them feel as comfortable as possible. They're part of the team as well. We also have behavioral health techs, BHTs. These are our frontline workers who are there to support the patient. Many of our BHTs are in recovery themselves, been there, done that. So if the patient is having a hard time, it's 3 o'clock in the morning, doesn't matter what time, they're there to support them and be their advocates. They also assist the team in assessing what's going on with the patient when they're not necessarily in front of us. We also have utilization review, who is working with their insurance companies. We have 12-step meetings, so of course they have a lot of support through the 12-step community. And so you can see that we have a lot of bio, psycho, social, spiritual treatment that is happening. And of course, we're finding that the best way to help patients recover from the pervasive effects of addiction is the biopsychosocial spiritual model. That continues throughout the treatment course. So in addition to detoxification, at some point, they're going to be stepped down to a residential level of care. And at the residential level of care, they're still in the same facility with the same treatment team. By the way, usually the second or third week of treatment is much more difficult. This is not always the case, but it's often, this often happens. It's more difficult because when the patients stop their detox medications, they're no longer receiving anything that is addictive, and they might have something called post-acute withdrawal. The symptoms aren't so severe, but they're there. They might have problems with eating, they might have problems with sleeping, they might have problems with pain management. They are starting to realize the consequences of their addiction. Their mental health disorders might be rising to the surface. So we sometimes call this a 2 or 3 week itch, and they might say to their families, I'm ready to go, I'm cured, I've got this, treatment isn't helping. So this is really, really key that they have this treatment team in place to help them through that hump. And it's very normal, it's very natural, but can be very upsetting for the patient and their families during this course of treatment. At some point, they're going to possibly step down to what's called a partial hospitalization program. And at the partial hospitalization program is where they step down and have a little bit more freedom. So what that means is they're still coming to treatment, and they still have a medical doctor, psychiatrist, so they still have this team, but they're not going to have the 24/7 around-the-clock nursing care. They will not require it. That is why it's called a partial hospital. For example, if we have a patient who's diabetic, they may not need to have someone monitoring their medication or their meals. So basically, they're becoming a little bit more independent, but yet they have the support of this treatment team. Now, they still have nursing involved, so on and so forth. They get to see the medical doctor, but it is not as intensive. And you'll see that with each step down, there's a little less intensity in terms of the treatment because the patient is experiencing, hopefully, a little bit more independence in taking care of themselves. And I like to call PHP the practice hospitalization program because now they have to practice some of the coping skills that they have learned at these 2 other levels of care. So in addition to that, we're still teaching them coping skills, biomedically, psychologically, socially. We want to teach them how to make healthy choices in terms of their peers as well.
Yeah.
So I wanted to make sure that you understand that, I'm sorry, we're in the middle of something. That they, I'm sorry, I lost my train of thought. That in the partial hospitalization program, it's kind of like having a foot still in the nest, but a foot leaving the nest. By the way, they may not be learning as much in the detox or residential level of care because they're feeling sick and their memory and their concentration is not so good. So this is really key to partial hospitalization program because they might have to revisit concepts and coping skills and process issues that potentially they weren't able to do necessarily in these two levels of care. It will definitely be more intensive and certainly more clear to them in the partial hospitalization program. At some point, they're going to step down to an intensive outpatient program. And what that means is, again, a little bit more freedom. So at Evolutions, I can't speak for some of the other programs, they will still have the team that follows them from the partial program throughout IOP. So what will happen is they will meet with their therapist again, one time per week. Family counseling, one time per week, as long as there's consent. They will have group therapies. They will have primary group where it's process therapy in addition to the psychoeducational groups. But at some point what's going to happen is they're going to have to start to become a little bit more independent, autonomous. So we encourage them at IOP to start to think about where do they want to work, what are they going to do with their free time. If they're retired, what are they going to do with their free time? Do they want to volunteer? So they want to start to look a little bit more in this, do you want to return to work? A little bit more focus on the social aspect in addition to the biopsychosocial model and spiritual. Do you want to get a 12-step program in place? Have you garnered a sponsor? Are you working the 12 steps? So this is where you're going to have the freedoms to start to do a little bit more of that exploration and actually put it into place. So some of our patients come to IOP 6 days a week. They will stay until noon and get all their therapy and then go back to a sober residence or back at home. Some of them come in the evening and they address all of this because they're working during the day. And then they will slowly start to go possibly from 6 days a week to 3 days a week, and at some point move on to outpatient counseling. So these are the different levels of care, but you can see that at Evolutions, we want to make sure that they have this interdisciplinary team that's following them throughout the course of treatment. And that's basically, in a nutshell, as briefly as possible, our different levels of care.